I'm Tracy, and in this video, I'm going to discuss my experience on valganciclovir or Valcyte for my ME/CFS and long COVID. For me, the upside far outweighs the downside, despite the drug's significant drawbacks. I'm not a physician, and this is not medical advice, just my experience and understanding. Valcyte is a powerful prescription drug approved to fight reactivation of cytomegalovirus, not ME/CFS. But it does work, albeit less well, against related viruses that are implicated in ME/CFS, such as Epstein-Barr and HHV6. Research and my personal experience suggest that Valcyte can be a huge help, especially with energy. Is it for you? Ask your doctor. My doctor keeps ordering labs for antibodies to EBV and HHV6, and they keep coming back way, and often way, way outside the reference range for signs of reactivation. That means valganciclovir isn't eradicating the problem with these viruses, but it is reducing the problem. When I go off it, my health gradually declines, ultimately putting me on the border of severe ME. When I restart the drug, I sometimes feel completely healthy for a day or two, but at the very least, I feel much less sick. And I want to underline this. Its effect on my energy can be stunning overnight. Unfortunately, something in me seems to adjust to it so that its effect, while still considerable, over time doesn't feel like a cure. And as an aside, if I can feel unsick for a day or two, there must be a way that I can feel like that indefinitely. The question is how, and the answer is not Valcyte, unfortunately. So, how does Valcyte work? I used to think that it went through the bloodstream looking for reactivated cells to kill, cells with reactivated virus to kill. My current understanding is that it might affect various types of cells, but loosely speaking, it prefers to bind to the DNA of the cytomegalovirus and less so, but still preferentially the virus of Epstein-Barr, the DNA of Epstein-Barr virus or human herpes virus 6. And when it binds to the DNA of the virus, it inactivates it, period. It feels like it's killing a bunch of cells because it can lead to a large reduction in immune cells and in red blood cells, which results in anemia, perhaps. And now I understand that this killing off of cells is not a feature of the drug, but a bug. Valcyte gets into the bone marrow and reduces the production of these cells. But that's not how it fixes things. So why is there a problem with reactivating viruses in the first place? I didn't have this problem before I got ME/CFS. If so, there were no symptoms. So the reason for the reactivation is unknown. Some have hypothesized that this reactivation is the central problem in ME/CFS and long COVID. But recent research makes it seem much more likely that the central problem somehow is something else, and that central problem somehow creates conditions in which these viruses reactivate. And when they reactivate, that leads to further problems, symptoms, and perhaps it even creates a feedback loop in which the reactivating viruses actually lead to other problems, which make it more likely that more viruses will reactivate, making the whole thing worse. Who knows? I made a diagram to help me think about where a treatment, not just Valcyte, or an infection or something else might have its effect. And even with all those arrows, this diagram is highly simplified, but the idea is that taking Valcyte would be something that you're doing on the bottom row. That's a behavior. And it's probably affecting my ME/CFS somewhere near the top of the chain of problems. but not the actual top. So in that sense, it's not a cure, but it's better than something that merely treats symptoms. My first 2 stretches taking Valcyte, I felt like crap after a brief honeymoon period, and I refused to ever take it again. I mean, when I was on it, I got anemia, I got a bunch of hives on my back, I had severe and constant hiccuping more than 100 times an hour, all day long. But I got really sick again, and my desperation persuaded me to try it again, but this time on my own terms. So instead of taking 2 pills every day, and actually an induction period of 4 pills every day, I experimented and I said I would take only 1 pill a day and see if I could handle that. Maybe 1 pill every 2 days, 3 days, like that. And what I found was that I can handle 1 pill every 3 days and only rarely develop anemia. Your mileage might vary. When I do get anemia, I back off. I totally stop taking Valcyte until I'm completely over the anemia, and then I restart again once every 3 days, or at least that's how I was doing it. I'll get to that in a second. So some people might worry that this low, infrequent dose would encourage the virus to develop resistance to valganciclovir. And my general practitioner poo-pooed that idea, but I actually believe it's a concern. The drug pamphlet suggests that resistance does develop, at least cytomegalovirus develops resistance to Valcyte. So it stands to reason that Epstein-Barr and HHV6, which are my problems, could as well. But the pamphlet also suggests that the resistance kind of resets after a while once you go off it. So it's not permanent resistance. Thus, I have started trying to take it in kind of bursts, pulsing, where I take it maybe 2 days apart, and then I take a break for a week. And I'll try different things to see how they work out. So if you are considering taking Valcyte, you should be warned, those pills are not cheap. Name brand Valcyte, which actually seem to make a difference, seem to be a much smoother experience than generic, is way too expensive, even with good insurance. Thousands of dollars for a 3-month prescription. Generic valganciclovir apparently can be had for about $2 per pill using a GoodRx coupon at the right pharmacy. And that's much less than my insurance formulary priced the generic version at. That was more like $10 a pill. So shopping around can really help. But maybe there are alternatives. A single study has shown that artesunate actually works better than valganciclovir against HHV6 and EBV in patients with ME/CFS. But unfortunately, artesunate seems to be available only as an infusion, and I haven't been able to get an infusion yet, get that approved. So at this moment, I haven't been able to try it. I have been trying a closely related supplement called artemisinin. Artesunate is derived from artemisinin. Artemisinin is over the counter. It's reasonably affordable. Unfortunately, research has shown that it lacks artesunate's effectiveness against cytomegalovirus, and thus probably against EBV and HHV6 as well. So I've been taking it for a while, and if there's a difference, it's subtle. It's definitely not like Valcyte. Famvir or famciclovir and Valtrex, not Valcyte, Valtrex, which is also known as acyclovir, are drugs that are related to Valcyte, but they're actually aimed at herpes simplex 1 and 2, and they have a much smaller effect on me, even when I take them in huge doses, which have been prescribed to me. Even though Famvir is reputed, hypothetically, to be better, Valtrex or acyclovir has actually worked better for me, but still not so well that it kept me from being borderline severe, that is, housebound, while taking mass quantities of it. So these are not actually true alternatives from my perspective. I was on IVIG and subcutaneous immunoglobulin for a couple of years, and they did not eliminate the need for Valcyte either, unfortunately. So in sum, valganciclovir, Valcyte, is sadly an unavoidable part of my regimen until something, hopefully, comes along that's better. I hope that this has helped you, and good luck with it.